specifically the Musqueam, Squamish, and Tsleil-Waututh Nations. We're very grateful for the opportunity to live, work, and learn on these lands. November's session is called the Right to Participate Initiative. We're really excited about this initiative. We've been talking about it behind the scenes for a couple of months, so really excited to have this really great project shared today. And giving the presentation is Monica Ho and Jessie Veenstra. Monica Ho is a clinical research coordinator with the Clinical Research Support Unit. And a fun fact about her, she's a little bit of a risk taker. She has hiked Black Tusk and even went beyond the Don't Go Beyond This Point sign. So you can ask Monica about hiking as well as the Right to Participate initiative. And Jessie is the research manager on the women's side for the maternal newborn program. And a fun fact about Jessie, really cool, is that she has an affinity for finding four-leaf clovers all over. She has hundreds of them. So she's also very lucky. So I was just telling her I need to start hanging out with her more and get that good luck. So thank you so much, Jessie and Monica. I'll turn it over to you.
Great. Thank you, everyone. Hello, my name is Monica, and I'm the project coordinator for this Right to Participate project. And joining me today, we also have Jessie Veenstra, the research manager for the maternal newborn program at BC Women's Hospital. Together, we're your point people for the Right to Participate project at BC Children's and BC Women's. Today, we'll be presenting on the Right to Participate initiative work, which its purpose really is to develop respectful and inclusive recruitment at CNW sites. Just a friendly reminder, since we have a lot to go through today, so I would encourage everyone to hold your questions and feedback until the very end. As we start this presentation, we again gratefully acknowledge that we are speaking on that BC Women's and Children's Hospitals are situated on the unceded and ancestral lands of the Coast Salish people, including the territories of the Musqueam, Squamish, and Tsleil-Waututh Nations. With this land acknowledgement, we acknowledge that there are structures in our system that cause us inequity, and this is really the base of what inspires us to continue with this project work. The Right to Participate work continues to break down the barriers for research staff to approach patients, not only including those who already trust and benefit from the system, but also those who don't, to increase diverse population to participate in research. Starting with our objectives for today, we will first introduce the Right to Participate initiative and why it's important, followed by providing some updates on the changes to date to permit its recruitment strategies at the CNW campus. We'll share available resources and closing off by having some next steps. So first, what is the Right to Participate initiative? The Right to Participate is an initiative to encourage and facilitate research participation from a diverse group of patients and families at BC Children's Hospital and BC Women's Hospital. This initiative is a campus-wide initiative, and it really works to develop and clarify respectful ways in which patients and families can be contacted to participate in research at our campus. This is also co-led by BC Children's Hospital Research Institute and the Women's Health Research Institute. Now, why Right to Participate? We believe that everyone has the right to benefit from science and that no groups should be unfairly excluded from the potential benefits of research participation. That's for TCPS2. Most importantly, research requires participation from a diverse population to make findings more generalizable. With that, I'll hand it over to Jessie to go over our research mandate.
Thanks, Monica, and hello, everyone. So in addition to what Monica mentioned about the right to participate, we also have a mandate to conduct research across PHSA sites and agencies. And here at BC Women's and Children's, that is supporting research to advance the knowledge and care of women, newborns, children, and youth, not only who are accessing our services here on site, but across the province and globally. And so with that mandate, it's also important to recognize that research is not only essential to improving the care that we're able to provide, but that it's inherently part of care. And so for anyone who was able to attend the Practice-Based Research Day recently held on October 24th, In the opening, Dr. Janet Davidson spoke to this really well, and sort of the advancements over the last number of years as we've seen supporting research here on site and really integrating that into the clinical care that we provide. That to be said, there's still work to be done. And so that's really part of why we exist as an RTP team to help advance and support that in a good way. And so if you haven't heard this messaging of research as care on site already, you will start to hear it a little more soon. And so just to situate us in terms of facilitating research here at Children's and Women's, so many of you should be familiar, hopefully are familiar with approvals required to conduct research here on site. So I just want to kind of go over a reminder of what that looks like, and also importantly, where RTP sits within that. So first of all, we have 2 levels of approval. We've got Research Ethics Board approval from the appropriate REB to make sure that studies that are happening align with ethical requirements, and that we're upholding the welfare of study participants, and also ensuring that we have institutional approval, which brings us to our 2nd level of approval. So this is from either Children's Hospital or Women's Hospital, and specifically the program areas that are going to be impacted. And with RTP, the really important thing is that we actually serve to support both of these processes to happen. And with respect to the recruitment methods that we're going to talk about in a few minutes, providing guidance in terms of processes, approved language, and templates that both these institutional and REB approvers are going to be looking for. So with that, we've talked a little bit about what RTP is, why it exists. I'm going to pass it back to Monica to share how we've gotten to this point, a little bit of background on how our work is being informed.
Great, thank you, Jessie. Now that we have established a bit about what Right to Participate is and what it exists, we'll now share a bit about who it impacts. From this initiative, we have 3 core stakeholder groups: the clinical teams, the patients and their families, and of course, our researchers. So before we began with this work, we wanted to understand what is currently being done on site and the facilitators and the barriers encountered. So for that, we conducted environmental scans to hear feedback from these 3 groups to continue to focus on our work on. We first began by hearing from our patients and families. From this, it became very clear to us that patients are very motivated to participate in research. For example, a participant shared, "What kind of motivates me is the feedback I get from the researchers after the studies are done. I get thank you cards, and this is what we have done with the research. I like to be kind of contributing, and again, we're not just another number." Another important point from patients that we heard is that they would like time to consider the research request. For example, a patient shared that, "I think probably advance notice gives me more time to think about it. So if I have questions, I can think of them in advance." After hearing from patients and families, we then switch gears to hear from our local teams. This work actually started back in late 2022, early 2023. In total, we interviewed 21 teams, of which 15 are from BC Children's and 6 are from BC Women's. From these teams, we heard that the 2 main mechanisms for active recruitments include the in-person method and the virtual method, which includes texting, mailing, email outreaches. In addition to that, we also interview other health authorities across the country to see what approaches they have taken. What we have found is that the consent to contact model is used as a recruitment strategy. However, it does come with its own challenges. For example, oftentimes incomplete study information are given out when clerks are obtaining permission to contact from patients. There's also very heavy training needs for high turnover rate clerk positions to utilize the permission to contact. And lastly, there are concerns around diversity and overall population of those who gave consent to contact. This really goes to show that there is really no gold standard that really exists. So that's why our team is taking time to work on and develop the process that would really work right here at CNW. Next page, please. So coming back to our local teams, we heard some barriers to in-person recruitment include busy clinic environment and the lack of research culture. For example, our team reflected what helped was some discussion with people and reminding them of things and having that conversation. I think it helps that we have such a presence in the department, like we're there every day. Next slide, please. Some other barriers we heard also include poor communication and coordination between recruiting groups, as well as the lack of recruitment standards and implementation tools in place. For example, a team shared that there were a lot of people recruiting in a specific unit and have seen a lot of research fatigue among people. This team will go to a patient and they will say, other researchers have already come to speak to me, so no thank you, I'm done for research for now. Another team also reflected that it was just really hard to know what to do because there isn't a standard. There's no guidelines, so I feel like every person doing it has to recreate the wheel by finding out how to do it again. From our environmental scan work, it became very clear to us that a standardized, transparent process and supporting tools and resources are critical to optimize research participation at our sites. And that would be most impactful for all three of our stakeholder groups. This is a key learning lesson that's been driven our RTP work to date, for which I will then pass on to Jessie to provide an overview.
Thanks, Monica. Yeah, so now that we've understood a little bit of what we've heard from our impacted stakeholder groups, what does that look like in practice? What's changing as a result of the Right to Participate initiative? First of all, I will start by saying this diagram is really helps to share how we're working. So a lot of what all of what I'm going to present here and our work going forward is really about piloting new initiatives, helping to refine tools, resources, processes, really kind of create those standardized processes that we heard would be really beneficial to everybody. And we're doing this in collaboration with many folks, working really closely with PHSA Privacy and Legal, with the UBC Children's and Women's Research Ethics Board, engaging clinical leadership, research teams, of course, as well as DARE with respect to accessing data, and of course, patient and family. So as we go through this process, just keep in mind that this is very iterative, and as we continue to kind of refine this, we'll be working toward site-wide implementation. So thinking back a few slides, Monica introduced the types of active recruitment here, in person and virtual. So the first recruitment method to launch that is newly permissible as part of available recruitment strategies here at both Children's and Women's is what we're referring to as direct approach in-person recruitment. And this launched back in the summer. And so we have a couple teams starting to use this, but hopefully more as you attend this webinar and become familiar with it. And you can let us know if you have any questions. But basically what you need to know about this initiative is first and foremost that it's going to look different in every program area and also for each study. So it's really up to those individual programs when you're obtaining and even prior to obtaining your institutional approval to help engage them and understand whether or not this is a method that will work for their program area and also considering the specifics of your study. So with that, we really encourage engaging clinical programs early. It's also a great way just to kind of open those communication channels and help to foster that culture of research in general here on site. Next thing to know about this method is that patient eligibility must be confirmed by either the principal investigator or a member of the clinical care team prior to approaching patients. And I should say, I kind of skipped over, but this direct approach really means that study teams now have the option to directly approach patients to introduce studies. So whereas in the past you've maybe heard feedback from the REB or seen in guidelines that it must be a member of the clinical care team to introduce the study, that's no longer necessarily the case, but again, it will depend on the individual program and also the individual study. And we must have sort of a mechanism in place to ensure that those being approached are still have been confirmed eligible. With this, the folks that are going to be introducing the study, while they don't need to be a member of the care team, they do need to be part of the PHSA family and is what is recognized as part of the PHSA family under the data governance framework. And so these are either going to be PHSA staff or affiliates. We know some of you on the call are not necessarily PHSA employees, but that you maybe work here on site and are integrated into research. And so important for you to know is that nothing with the way that you're currently working needs to change. We still have our current kind of onboarding in place. So anybody that is going to be introducing studies will be a member of one of the appropriate research institutes and have gone through various onboarding processes. As we incorporate new initiatives through RTP, there may be additional approvals or onboarding requirements, but a lot of that's very much still in development. So we can share more information about that as it becomes available. The other important thing to note about this method, and we always encourage, is not listed here, but just to also work with clinical programs to make sure that there's a space identified to be able to have these introductory conversations in a private setting where patients can ask questions about the research. And importantly, that you're also coordinating with other research teams that might be incorporated or recruiting in the same time frame from the same space. And if you have any questions about this, of course, you can always reach out to us. And we do have a kind of quick start guide on the WHRI and BCCHR RTP web pages where you can do a little bit of a self-assessment as to whether or not this approach might be a good fit for your team. Now, the second initiative that we're working on and is in the pilot stages right now is kind of captures that the other methods of recruitment, or what we refer to as virtual recruitment, including mail out, email, text messaging, basically anything that requires access to patient contact information to be shared prior to consent being obtained. So for this reason, you might hear us refer to this as contact information release. And this isn't necessarily a new method. We know many studies are recruiting through mail, email, some even by text currently. But if you are doing that, you might recall that it was a bit of a process to have it approved, needing to undergo individual privacy assessment. Lots of questions on all sides, both the research teams, but also within PHSA to make sure that this is being done in a good way. So the work that we're piloting right now is really to help define that standard process, make sure that it's very clear for everybody going forward so that we can support more studies to recruit in this way. And really importantly, that it's a process and that tools and mechanisms are in place so that everyone involved can have confidence in the process. So as I said, this is a pilot that we are doing right now with one study at BC Women's, and we're working really closely with DARE, Privacy, and Legal to test this process out. So we will continue to share more information about this as it becomes available in the coming months. So you can stay tuned for that. The one thing I will note is that for studies that are using any of these contact methods, a new thing to be aware is that the study will now need to be posted to the Women's Hospital website or the Children's Hospital website, depending on where the research is taking place. And the reason for that is really for patients to be able to confirm the legitimacy of their research when they are contacted about it. So with that, you will find that there is now new approved RTP messaging can be found on both the hospital websites. The screenshots here, just to give it a quick overview, they're by no means comprehensive. There's quite a bit of information here. So where patients can kind of navigate questions around how their information was obtained or provided to research teams, why they might be contacted, and importantly, their right to participate in research. And as I mentioned, in the past, where you might post a research opportunity to a website in order to recruit participants. That's not necessarily the only reason that you might now post a study to the website. As I mentioned, with the virtual recruitment methods, it will actually now be a requirement that studies using virtual recruitment post that information to the websites. And just a reminder, in all cases, any patient complaints received by research teams or clinical teams related to research should be reported to the REB and also to the RTP team, which you can do through our general RTP email account, which we'll share at the end. So you might now be wondering, Monica spoke a little bit about permission to contact earlier, and our external scan, we found that this is something that is pretty widely used in other jurisdictions as an organizational approach. And this is really where patients agree to receive information about research that they might be eligible to participate in before obtaining informed consent. What we found, as Monica spoke to, is that this has its own limitations. So it's not necessarily something that we are adopting as a quote unquote kind of site-wide standard here at Children's and Women's, but it is still one of the methods that is available. So we know some research teams are using permission or consent to contact databases, and that works really well. And so if that is the case, you can continue to do so. But just to note that it's not necessarily something that is a good fit for everyone. So if you are using this as a process, we just encourage you to reach out to us so that we can help to ensure that your messaging and the way in which those you're collecting information is in line with the RTP principles. And if you're unsure as to whether or not this is a good fit and maybe considering using this as a method, we do have some resources available to help determine if it is, if it's a good fit for you, and you can reach out to us to help navigate that as well. And just really kind of bringing us back to what I spoke to earlier, that remembering research is care. Part of the reason that we don't necessarily want to adopt this as a wholesale approach is we really do want to create that awareness and understanding that this is a research campus, and that folks receiving care here may be approached to participate in research while receiving care on site or after their visit. And with that, I'm going to pass it back to Monica to talk about next steps.
Great, thank you, Jessie. So as Jessie mentioned before, the work of the right to participate is ongoing, and this is an iterative process as we continue to receive feedback from all stakeholders. With this, the role of the right to participate team is to continue to support research and clinical teams to adapt to the new research recruitment workflow if it works in your program area. We also continue to pilot and refine the process and the templates as we receive feedback from our pilot groups. We also have a role to communicate any updates or any new processes as they are confirmed after we have been working with our stakeholders. Lastly, also to liaise with the collaborating partners, including REB, Privacy, DARE, and etc. Next slide, please. So setting up for success. For teams that are wishing to utilize the RTP recruitment process, we really strongly recommend you to, number one, engage your clinical program teams early. This really is an opportunity for you to sort any kinks and also to get any questions answered. Also, as Jessie spoken to before, to post your study as a research opportunity in your respective research institute websites. This is a venue where the patients can ensure transparency of the research studies and also can validate for research information that they have received either through in-person methods or virtual contact. We also encourage that teams to include research language in the clinical communications. For example, the clinic welcome packages, appointment reminder emails, or even sending study brochures to participants ahead of their clinical appointments. Again, this really addresses where patients need to have additional time to consider the research requests before arriving to the clinic area. For programs that have multiple research teams approaching for participants, we encourage you to coordinate your approaches amongst each other so that we avoid overwhelming our patients. Lastly, ensure that all research discussions are held in private so that we can protect the participants' confidentiality. In summary, we are really, thanks. In summary, we're really your point people for Right to Participate, and we can help to clarify workflows and best practices for participant recruitment in both the in-person setting and the virtual setting. Our work continues to develop and share recruitment-related tools and resources as we receive updates and feedback. We're also the resource and your contact for questions from patients, families, clinical programs, and as well the research community. As mentioned before, we monitor and address the initiatives, including what isn't working well, the areas of improvement. So if you have any questions or feedback, please reach out to us. With this, I'm happy to share that we have some official resources available on our official sites on both the Research Institute's websites. For our contacts, you can email us at the rtp@cw.bc.ca inbox. Both Jesse and I have access to it, and we can tag teams to respond to your queries and questions. This then concludes our presentation today. So now we're happy to take any questions or any feedback. I see that there are quite a bit of questions in the chat box and the Q&A. Guess we can start with the Q&A, Jesse?
Yeah, absolutely.
I think some of the questions are answered in the chat box already, so let's just start with the Q&A.
Okay. I'm going to just read the first question.
Yeah.
Oh, okay. Yeah.
Yeah, we've moved all the questions. Thanks, folks. So questions, just putting those into the Q&A. That would be awesome. It looks like we've got 3 there.
Thank you, Nicole.
Okay, so I'll start with the first one that I see here. So by far the most efficient way to recruit outpatients to a research study at CNW is for physicians, nurses, and other healthcare providers to be able to ask patients the following question. We have many research projects here, and there is one I have in mind for which you might be eligible. May I give the research team your contact details so that they can call or email you? Currently, at least for provincial medical genetics program, this is not endorsed as a method of recruitment, and the rationale is it might be perceived by someone as coercive. Never understood the worry. I believe it's massively overemphasized and the impact on the program and resources as it offloads everything but single sentence and single email to the research team. Will the Right to Research group endorse the above approach specifically within provincial MedGen? I don't know that, so I can take a stab at this first, and then you can jump in. Totally understand how this is, there's a lot of elements in terms of what's practical in the clinical setting. To answer your question in short, I can't say definitively whether that would be endorsed. We need to take it offline and just kind of work through the process and how and make sure that we're engaging our partners with privacy and legal in terms of how we approach that. But certainly in terms of that type of introduction, we can work on a clear approach both within this program and other approach that that everyone can feel confident in. I would say that part of the work that we're doing that Monica mentioned in terms of encouraging that we're sharing out that messaging through clinic reminders, any opportunity before patients arrive on site to incorporate information that folks may be approached about research. Part of that is to help kind of preface that so that patients are aware that they may be contacted. Monica, I don't know if you have anything to add to that.
Yeah, exactly. Thank you, Jesse. I think it's I think I have a very similar concept in mind as you as well. And remember, the Right to Participate process is really very project specific and program specific. So if your current way of recruiting for participants is for nurses and doctor and physicians to introduce research studies, then If that works for your program area and that's already be approved, then you can continue to do that. This newly permissible process is only a newly permissible process. It's another option for you to consider when you are thinking about your recruitment strategies to optimize your study recruitment.
Mhm. Yeah, and I think the last thing that I'll mention too is that our role is really to help kind of provide that these processes, template language, and things that can be incorporated into your to a study's recruitment materials that are approved by the REB and then by the institute. So really, it is ultimately up to the programs to determine what works for them.
Perfect. Right, and we can move on to the second question.
Sure. So the second one is in regards to, I think, what I spoke to about PHSA employees and affiliates. So we have a research team that is all UBC employees, but works out of BC Children's Hospital. Can you approach patients without having a PHSA employee introduce the study? So this is where, as we mentioned, you would be considered, if this is an approach you're currently using, it's because you're considered part of kind of the PHSA family. So as a PHSA affiliate, but in every case, we want to just make sure, we encourage you to email us and just make sure that we're checking the data governance framework, that it does, that your team is considered PHSA affiliates, and that we have the appropriate legal and privacy checks in place. But by no means do we want to impede research that's happening here. That's not the intention.
Mm-hmm. And remember, those conversations are ongoing with privacy, legal, and REB with our collaborating partners. So by getting in contact with us, we'll be able to send you any updates, any information as it becomes available. So also make sure that your team members who are UBC employees but working on the PHSA ground to be onboarded to through the Research Institute onboarding system.
And the next question is about some suggested strategies to coordinate with other research groups in contacting patients. So this is a really great question, and I think the best way to approach this is really by, as we mentioned, when in doubt, kind of engage with the clinical programs early, and we encourage that of all teams, because if they're aware of what research is happening, they can help to make sure that different research teams are aware of each other, because you may not necessarily cross paths otherwise. And that helps the research or the clinical teams to just kind of keep a sense of like what research is happening within the program. And depending on where you're situated, certainly within on the BC Women's side, we have the research managers in place like myself who can help to facilitate that. So for instance, within maternal newborn, I can be a point person to both the clinical team and the various research teams. So one of the things we're trying to do is help to keep a sense of what research is happening and where it's at in its kind of research arc and recruitment arc, so that we can help facilitate those connections between teams. So definitely, though, when in doubt, engage early and coordinate with the clinical teams.
So I think the next question is, does this mean that requesting the contact list for people who are not approached for consent to conduct goes to RTP team now instead of privacy now? I think this pertains to the virtual recruitment method that Jessie spoke about. So to request for the contact list for people who are not previously consented to contact, the process goes to that there will be a DARE request form as per usual, but as we're piloting this new process, and because we're still in ongoing conversations with the two teams, if you're interested to request for a contact list for your recruitment purposes, please contact us, because then you could be one of our pilot groups to pilot our new processes. So all to say that reach out to us and we can see what is the best way moving forward for you.
Yeah, and I'll just add to that too, that RTP in itself is not, we don't necessarily approve anything, but we help to kind of facilitate those approvals. And the goal with the work that we're doing right now to kind of streamline this process is to kind of have one overarching privacy assessment and approval with a standard process so that each individual study doesn't have to do that every time.
Perfect. Next question, do we have plans, do we have template languages for RISE and PUFs? So yes, we do have some templates available for RISE application, especially for the in-person process. That is actually available currently. So if you're interested in piloting and using our processes, please reach out to us. We can share that with you.
Yeah, we've got lots of information in the background. Part of the reason it's not broadly available to kind of access on one of our websites or anything like that is just because it is, as we mentioned, we're still kind of in this kind of iterative process. So until we, while we continue to make changes, just reach out to us and we can share those.
Exactly. Does this change mean researchers can now directly email, call families to invite them to participate in a research study, i.e. we don't need to first send a letter of invitation through post mail? I think this is a really great question that's pertaining to for our virtual recruitment methods. So short answer is yes. However, there are some resources and templates there are some specific languages that that's actually given and advised by the privacy office to share with the participants while you're doing the initial reach out. Although it is right to participate was saying that everybody should be contacted for research, but we also need to make sure that this contact is in a respectful way. By no means that when they decline one research means that they are declining research at the entire hospital. So we need to make sure that there is a clear message being delivered to your potential participants and to ensure that there is no misunderstanding there. So if you're interested in using that, again, please reach out to us. We'll have some template languages that will be important for you to share with your participants. Jesse, anything to add from that point?
No, I think you covered it, but yeah, we're working towards making email and call and text available.
Do you want to take the next one or?
Yeah, so okay, so we've tried to get research information in patient welcome packages before, but we're shut down. Does this mean that we can reopen these discussions? So what I would encourage here, rather than individual teams having to try to do the legwork on this, is that's kind of why we're here, is to help facilitate these discussions and take kind of a site-wide approach. So that's part of the work that we're doing right now, is to create some standard language that can be included and go out in welcome packages and things. And again, that's going to vary depending on the program area. Outpatient is going to be different than inpatient, but to be able to provide that standard language. So we are aware of it. We know it's something to work towards, and I would say you can leave that to us, and we'll provide more information as that hopefully becomes available.
Mm-hmm. And just a point to add that we actually have done presentations to our leadership, the PHSA leaderships before, so they're very much aware of our processes and this being, a work in progress. So if you're interested to reopen that conversation, please engage with us and we can kind of help you determine the next steps forward. Is the RTP approach being piloted with both inpatient and outpatient recruitment? I can speak from children's, and maybe I'll leave the women's side of things for Jesse. So starting with children's, yes, we are actually piloting both the new process, both the inpatient and the outpatient recruitment. And in fact, we're actually looking for pilot groups. So if you think that this process will work within your unit and it will benefit your study, please reach out to us. We can help you provide some resources for you to implement this process. Anything from women's, Jesse?
Yeah, I would say similar. It's available to both sides. With respect to the direct approach in-person recruitment, I can say that that's the way that, depending on the study, certainly on the inpatient side at Women's, that's the way that some research teams are working already. They have a good relationship with the clinical teams. We haven't seen a ton of new studies requesting this, so if it is of interest, yeah, definitely reach out. We're curious to pilot it with more studies and see how it's working on both the ambulatory and inpatient setting. And then in terms of the text-based recruitment, that is actually being piloted right now on the inpatient side for Women's. But again, yeah, one or two more folks or studies looking to do that. Please feel free to reach out.
Perfect. And I think, oh, another question, following up with the first question that was posed, can you clarify the distinction between sharing contact information for locally approved projects, research, versus others are happening outside of our local REB? So I think first thing to really determine is that the right to participate is really looking at research projects only. So this really does not apply to QA. That is determined as outside of the scope of our initiative. So strictly speaking about research projects, the distinction between within our REB jurisdiction and the others is that this initiative is currently being piloted only under BC Children's and Women's Hospital. Not the whole entire PHSA just yet, but we're going live with our sites only. From our collaborators, we are hearing some interest from other PHSA sites, but then we're just starting out with our CNW. Again, we wanted to make sure that it works for our local groups and it slowly scale up, and then, hopefully in the future it goes bigger. So to your question, the distinction between outside and the inside. So if your research project is approved by the REB, or you are thinking of inputting or submitting an REB for your projects, and you're hoping to use the RTP process, get in contact with us. But if it's anything outside, then that will have to be something that is potentially in the future.
Yeah, and feel free, let us know if that answers the question, because as I'm looking at this, part of what I'm wondering is if the nuances in it would be research happening here, but might be as part of like a multi-site study, in which case where you would have kind of harmonized review from other REBs, in which case I would say we would have to just learn more about the individual study and let you know either way if that is the case. Last we have here, not a question, but a comment. Many families have language barriers. It would be amazing to have on-demand interpretation services for research, especially if we want to have diverse study populations. Absolutely, 100% agree. That's definitely a limitation in terms of where we're at currently, but that is part of the intention of Right to Participate. And maybe I can pass it to you, Monica, to speak more about that, because I think there is a little bit of work happening on the children's side to help support that.
Yeah, exactly. So we definitely recognize language being one of the barriers that teams encounter and patients encounter. So we are actually working very closely in tandem with the language barrier projects right here at the Research Institute. We are working to understand how the both initiatives can come hand to hand, and then to hopefully in the future work on translating some materials, so that not only English or French speaking groups can hear about research. And if you need a more immediate support for language issues, feel free to reach out to the Language Barrier Project contacts. I think they'll be able to help share some resources with you.
Awesome. And I see, thank you, Julia's shared the Umbrella Multicultural Health Co-op. And in respect to the previous question, yeah, so it is a multi-site study that is happening elsewhere. So yeah, I would say my first response is that anything like This is still going to pertain to any patient specifically here at Children's and Women's, so it still need to go through our approval processes. But again, yeah, feel free to reach out to us and share more specifics. I'm happy to kind of troubleshoot that with you.
Okay. Good. It looks like we got through all the questions. If you have any more questions, feel free to type it into the Q&A box. And as well, we have our contact information, so feel free to reach out to us if you have any other questions after this presentation.
Right, thank you so much, Monica and Jesse, for joining us. And yes, like Monica said, please feel free to reach out to the Right to Participate initiative. Contact Jesse if you're affiliated with the WHRI, or Monica if you're affiliated with BC Children's. Thank you, everyone.
Thanks, everyone.
Awesome. Great. Thanks.